Good afternoon, everybody. Thank you for coming. I'm, as you can see, already having technical difficulties with my slides. So please give me 1 second while we try again. Um, there we go. Right. Hoping you can all now see that. So I'm here today to talk to you about virtual wards in Derby and Derbyshire. As Mark said, my name's Victoria Byrne and I'm the outgoing programme manager for virtual wards. Virtual wards are designed to provide hospital level care at the place you call home. So that could be your house or a care home, the usual place you live in. It's a safe alternative to NHS bedded care, and the support in and on a virtual ward is provided for patients that would otherwise be in a hospital. So you'll get the same treatment on a virtual ward that you would if you were in hospital. Um, Predominantly in Derbyshire at the moment, we support early discharge. We have a couple of services that prevent admission into hospitals in the first place, and I'll talk to some of those in a bit more detail. This slide is the national definition that came from the national NHS team around virtual wards and what they should be providing for patients on a virtual ward. So the objectives of the virtual ward were to contribute to key urgent emergency and critical care strategy. So that's to reduce emergency department attendances, to reduce admissions and readmissions to hospitals, and to reduce length of stay and improve flow through our hospitals. Derbyshire was set a target by the national team to deliver 225 virtual ward beds across the county with a use rate of 80%. We're not quite hitting those targets, and again, I'll talk to some of that in a bit more detail as we go through this presentation. We want to ensure that patients receive timely care in the right setting from the right person, and we want to reduce reliance on turning up at emergency departments or other non-elective care services where possible by providing care at the place you call home. We're also hopeful that in delivering virtual wards across Derby and Derbyshire will help support those other emergency care standards to improve. So that's 4-hour wait times, ambulance response times, and the occupancy within our hospitals. So, what is a virtual ward? It sounds quite scary, I think, sometimes when we talk about remote monitoring and sending you home when you would otherwise be in a hospital. I think it's really important to note that you'll still have a consultant and nursing team looking after you, checking in on you every day, should you need to be on a virtual ward. But virtual wards allow suitable patients to get the care they need safely and conveniently where you live. Sometimes that involves monitoring technology such as blood pressure machines or taking your own temperature. We can even take ECGs using tiny little bars that you pop your thumbs on at home so we can check how your heart's working using those. Sometimes it's a face-to-face visit and sometimes it's phone calls. So there's a lot of ways that will make sure that you're still safe at home whilst you're on a virtual ward. Monitoring technology does mean that you might have to use an application like you would see on a smart or a modern mobile phone, and you would wear some of that technology that I just alluded to. And all the technology you would need would be provided to you with clear instructions. And remote monitoring team that we use have a dedicated phone line. So if patients are struggling to use the technology at all, then you can call straight through and get the help that is needed. What happens on the virtual ward and who will look after me? So as I said, you still have all that same hospital team and structure around you, making sure that you're safe when you're on the virtual ward. It's hard to say exactly who would be looking after who because every patient is different. And as I said earlier, we want to make sure that we've got the right professionals, the right patients, and the right care at the right time. Once you get home and you're on a virtual ward, if you've been in hospital, the virtual ward team will check in on you every day to make sure that your cares and your health is improving in the way that is planned. and you'll be completely involved in any care decisions whilst you're on that virtual ward, as you would if you were in a hospital. So it'd be an ongoing conversation with the clinicians and with the clinical teams that are caring for you to make sure that you're still feeling safe and comfortable, and that they're happy you're safe and comfortable too. How do you access a virtual ward? So if patients are suitable for admission to a virtual ward and they're in a hospital, ask, please ask. I would love to get a story of a patient that has asked to be on a virtual ward. I feel like then we've really hit the target of people knowing what they are and what they do. And we also have two virtual wards that can be accessed from home. So if you see your GP or you ring 111, there are two virtual wards that can accept you at home to prevent you making that trip to hospital in the first place. And there's just a little picture here that sort of shows you the journey for patients that are in hospital that might be suitable for admission to a virtual ward. So you'd be identified by a consultant or by the virtual ward team. If appropriate, that referral would happen and they'd work to get you home as quickly as possible. So what do we have in Derby and Derbyshire? As I mentioned, the planned capacity in Derbyshire is 225. We currently have 175 beds as of the last couple of weeks, so slightly more than what is in this slide. So there's 45 beds for cardiology patients, there's 25 for respiratory patients, there's 50 in the community, and then we have 10 frailty spaces in the north of the county. That's a bit of a pilot, and we also have 10 for end of life and palliative patients. And this slide also just shows you how well used they are. So you can see that there's still scope for more patients in Derbyshire to be able to access a virtual ward, and that's something that we're actively working at improving on a daily basis. All of the virtual wards in Derby and Derbyshire have access to remote monitoring, and we are quite unique in that sense. But as we sort of mentioned in those previous slides, it's not, you won't necessarily get remote monitoring. It'll be whether that's appropriate for you and the care that you need should you or your loved ones find yourselves on a virtual ward. And we also have access to something called point of care testing, which is equipment that allows nursing staff or doctors to come to patients at home and test their bloods and get in the moment results to understand how patients' care is progressing. Just a bit more data here around how Derbyshire are performing with their use of virtual wards. So as you can see from the graph on the right, the blue line is what the plan was for Derby and Derbyshire. The orange is what we've been able to achieve, and then the grey line shows how many patients are actually accessing that service on a sort of fortnightly basis. So it's a bit of an average. The table on the left is the statistics that are shared nationally, again on a fortnightly basis. And you can see there that the trend is improving. So those active conversations around how we encourage and support more patients to use virtual wards are clearly starting to work. So what's next? We want to keep increasing our utilisation of virtual ward beds, and we would love to hit 80%. We sort of seem to be around 76 pretty consistently at the minute. So we're getting there slowly but surely. And this would see around 180 patients on a daily basis being cared for at home instead of at hospital. We want to ensure that we've got consistency in the provision across Derby and Derbyshire. So where we've got services only available in the north, we're looking to roll those same services out into the south of the county so that all patients can access the same care in the same way. And we're going to keep reviewing and piloting new pathways so that more patients can access virtual wards without having to access a hospital first. I've put some frequently asked questions up on here. I'm aware that we've like sort of whizzed through, so I'm hoping there's lots of questions. I'm sure that there will be, but lots of the common questions that we get around what technology will be needed and will you need internet and broadband to be on the virtual ward. No, you don't. We can provide all of that, and all of the equipment that we provide is already enabled to do that. And both the staff in the hospitals and the team that provide that equipment are well equipped to help patients be able to use and understand that equipment. The monitoring technology can be used for a range of different things. So we can use it for video consultations. We can use it to send questions to patients and messaging, to take photos of rashes and things like that. And we can also use it to take your observations like your blood pressure and temperatures. Patients are often worried about questions they might have once they're back home, but you'll have the same access to a hospital-based team or a virtual wards team as you would have if you were in the hospital bed. So you'll have contact details and you'll be able to call them or use that technology that we talked about to send messages to the staff that are supporting you on the virtual ward. We know a virtual ward won't be for everybody, and we hope that in time more and more people will feel confident and comfortable to have that hospital level care at home. However, it is entirely an informed shared decision between the patient and their clinical team as to whether or not a virtual ward is the right thing. So please, if you're ever in the situation or a loved one's in the situation where you think virtual ward is appropriate, feel empowered to ask. But also, if you don't think it's the right decision for you and your loved ones, you know, that will be taken into consideration. And another frequently asked question we get is around how to contact the virtual ward team. And as I said, you'll be given that information so that if you've got questions or anything changes, you can feel confident and comfortable in the care that you're getting at home. That's it from me. Thank you for listening. I guess we'll open to questions.
Thank you, Victoria. That was a great presentation. During the presentation, I was actually writing down some questions, and then you kept answering them as you carried on. So it was really, really informative. So does anybody in the audience have any questions at all for Victoria? If you'd like to, you can just turn on your microphone and ask your question.
Yeah, there's a question from Rachel, I think.
Hi, yeah, thanks, Victoria. I'm a service manager for the Derbyshire Home from Hospital Support Service. And I just think maybe not in this meeting, but I think it'd be great if we could have maybe a further conversation around how our service could potentially support patients on the virtual ward. We're a voluntary organisation and support with shopping, collecting medication, emotional support, obviously signposting and referring into other appropriate services. So I just think it would be a good opportunity just to ensure that the staff who are overseeing and supporting this work in the virtual wards know about us really, so that we can also support to try and keep those people at home for as long as possible and as independent as possible. So perhaps to say we could maybe have a meeting outside of this just to have a talk about that, of how we can just build that relationship.
Yeah, absolutely. Rachel, if you don't mind dropping your email address into the chat, I'll happily reach out.
Lovely.
I did mention at the start that I'm the outgoing program manager, but I'll make sure it's passed on. And that Home for Help service has been on my hit list for a couple of weeks, so we'll definitely get in touch.
That's brilliant. Brilliant news. Thank you. Great presentation. It was great to hear more about it. Thanks, Victoria.
Thanks so much. Thank you.
John, I see your hand up, but first, Carol Stone has put a name in the chat. Carol, do you have a question? I'm going to guess not. Okay, can we go to John? Do you want to unmute and ask your question, John? And then if Carol wants to afterwards.
I think I am unmuted. Am I? Can you hear me?
Yeah, we can hear you.
Okay, thank you. Right, thank you. Lovely presentation, Victoria. Sorry to be losing you. I hope you're going to stay around in some capacity, whatever. I don't know, but anyway, I messed up in the chat about the SBARD form. I hope everybody knows what that is, because I think carers should be able to do that and feed into the team. I'm in an interesting position as a carer for my 92-year-old mother. I thought we were on basically running a virtual ward here. We have the hospital bed, we have all the kit and stuff, but I don't think we're in your numbers. She's under Dr. Namby at dermatology in Derby, and we're going to vascular next week at the Royal Derby. So we've got a lot of people in our lives. District nurses twice a week. They come down to 3 times a week, from 3 times a week. I guess my question is, how can we make this more enduring, and how do we get GPs to embrace this idea, because they do seem reluctant. I mean, the last time a GP was in there, he was again threatening with a care home and hospital, and I'm thinking, why? Why she doesn't want to go there. Anyway, sorry.
No, I think all valid concerns and points to raise, John. Thank you, and thanks for coming to listen to the talk. I think there's some really specific guidance at the minute around what constitutes a virtual ward and a virtual ward stay. And whilst it sounds like that is absolutely the level of care that you're giving your mum at home, I think the key thing around what we is classed nationally as a virtual ward is that sort of short stay. So where your mum might have a deterioration and go in for a few days, that's the sort of level of care that we're trying to put in place to avoid that, if that makes sense.
Yeah.
So that sort of like long-term and enduring care isn't quite where the virtual wards are at the moment. And those other great teams that you talk about getting care from are doing that, are filling that space, I suppose, right now. I think the point around other clinical staff members such as GPs maybe be having levels of reluctance. I can't talk to, I'm not a clinician, but I think that there's a lot of risk, isn't there, when look at how ill your mum maybe is, and everybody just wants to make sure everyone's safe and well, and that's really difficult to do if you've not got eyes on somebody all day every day. So whilst I can't speak to your specific situation, I think that is something that this programme has faced into over the last 18 months, that there's just a bit of maybe worry or anxiety about whether patients are truly going to be safe if they're not in arm's reach, so to speak.
We've been doing it 2 decades, Victoria. I've not just started doing this, and it's 24/7. And they messed up a dressings change the other day, and I had no sleep, and I didn't know what was going on. That's all. It's communications, as I'm sure you're aware, communications that let us down all the time. But anyway, we're getting there. We are getting there. Thanks. And I posted on Care Opinion about this, by the way. Hope everybody knows about Care Opinion. James Munro, brilliant website out there. Please praise staff as much as possible, because you're doing a brilliant job. Thank you.
Thank you.
Thank you very much, John. I think we have a hand up from Lisa Brightmore. Lisa, would you like to unmute?
Yes. Hi, Victoria. Thank you for the presentation. It was really informative. So I'm the fairly new engagement lead for the discharge improvement team, and we are looking at some crossover, I think, in some of the challenges that you might have experienced, that they're experiencing within that project too. I was wondering, from an engagement point of view, what's the feedback been like from the patients and the families or the carers that have used this service, and how have you captured that?
Yeah, so we've done a number of things. We do have sort of offboarding surveys that are sent through that remote technology that we use. There is just sort of in the moment feedback through the clinical teams as well. It's really well received. There's a small cohort of patients with carers where the carers have felt, I think, a bit of they maybe got a bit of respite before, where a patient might have gone into hospital that they're not getting now. So that is something that we have had to consider and make sure that we're taking into consideration the needs of the carer as well as the needs of the patient in those situations. But generally, it's really well received. One of our virtual wards provides IV diuretics for heart failure patients at home, and those patients would have typically still gone home in the same time frame but had to travel into the hospital and out every day for up to 14 days, and that would have been around a 6-hour stay in hospital. So the fact that we're now being able to deliver that at home is massively well received by those patients and carers. I mean, especially in the middle of winter and when it was snowing and someone's not got to make that trip. So it is well received. I think the majority of the challenge comes from clinical teams and the risk that's associated with moving a patient from the acute back home. I think the other challenge is around making sure that the teams are joined up. So like John just spoke to, there's the communication there, and there's lots of teams within Derbyshire and Derbyshire that are trying to do similar things with lots of crossover, and it's that making sure it's as efficient as possible as well. But yeah, the engagement's been really good, and the feedback from patients has been really great. We do a 12 weekly survey as well that's just for the general public, that's just to gauge sort of how awareness of virtual wards is changing. So the first one we did, we got, no, I don't really know about one, but we think it sounds okay and maybe it would be good. And the next one we did was like, yeah, we know about one now, but I've not used one and it sounds like it would be good. And we're just starting to see it sort of drip, the improvement sort of drip through, that more and more people know about it and more people have used one. And we just keep doing those sort of like regular quarterly check-ins in however we can to get that information. We have had some patient focus groups planned for the end of the summer as well, so we'll be hopefully posting some information around those and inviting patients that have been on the virtual ward to come and tell us about those experiences too.
That would be great. It'd be good to be able to come along to that perhaps as well, to be part of that. Thank you. That's really great, and thank you very much for sharing that.
Thank you.
Okay, I've just covered some traffic that's in the chat for those that haven't seen. Rachel Stillwell, for you, Victoria, there are some contact details. If you can pick them up at the end of this, that'd be great.
Thank you.
Carol Stone has told a tale that she went to see her uncle at home in his bed, and this sounds very much the same. And she said it worked very well in the past, and with modern technology it should be much safer and much better for the family at home. And also Sharon Gibbs has come in to say that we're developing community-based frailty teams as well that will work closely with the virtual wards and our primary care teams and GP practices as we move forward with these developments.
Yeah, and Sharon and that team will be really key to sort of that communication between the GP teams. So that's an area that Sharon and her colleagues already work in. So Sharon and I are getting to know each other better by the day, I think.
Yeah, I imagine networking is really important for this as well. So are there any other questions? Does anybody would anybody like to unmute and ask a question? Okay, that's excellent. What we're going to do then is we're going to bring this session to a close, so everybody gets half an hour of their day back as well. So if anybody has any questions whatsoever about this session, please feel free to either contact Victoria through this chat, or they can email me on the details that I've given, my personal details, or ddicb.engagement@nhs.net, and I can raise anything with Victoria that you so wish. Also, any questions and answers that have been discussed during this session will be published to the Derbyshire Dialogue tile. You should all have a link for that. I send it out with every email that we do. So what I'd like to do now is just thank Victoria Byrne really so much for that excellent informative session on virtual wards. They're really exciting, and it's great to learn about them. Thank you also to our two signers, Helen Blunden and Helen Brooks, who have done a fantastic job. Thank you very much. But biggest thanks, of course, are to all the guests on the call. These sessions are put on for you so that we can tell you what's going on, tell you about new stuff, but also get feedback from you as well, which is really important. And we hope to see you in the next session of Derbyshire Dialogue, which is the Derbyshire Dementia Strategy. That is going to be on the 21st of August. Invites for that session will be sent later today or tomorrow morning to everybody on the Derbyshire Dialogue distribution list. If for any reason you're not on the list, feel free again to contact me and I can add you to that list. And with that, I'll bring this session to a close, and thank you once again for everybody's time. Thank you.
Thank you. Bye.
Thanks very much. Thanks.